Right, part 2, flossing. I've got lots of patients who are really, really good at cleaning in between their teeth, and I spend a lot of time training people, trying to keep them motivated because it's not the easiest thing to do. And talking to a lot of people again, it seems to be gone out the window a little bit. So if you have got a bit more time, I think now is the time to really get good at this. Again, a couple of different ways of doing it: flossing, interdental brushes, air flossers, etc., etc. The main thing is it's getting the plaque in between the teeth that no toothbrush can get to. If left there, it becomes a really nasty mix of bacteria. If you smell the floss, it stinks. Not very nice stuff. You don't want it in your mouth. But because it's in between the teeth, we're not that aware of it until we get really good at flossing, and then you'll really feel the difference. You won't get as much bleeding, etc. I discussed what bleeding is a sign of. Bleeding is a sign that you need to concentrate more, need to do more. It's the nasty bacteria that cause the inflammatory response in the mouth. The more of that you remove, the healthier the gums will be. The bleeding will come down, and your risk of losing bone in between the teeth, which is where a lot of adults get it because flossing is so boring, and then they're at risk of losing the teeth later on. If you lose enough bone over time, then you're in trouble, and you're trying to think about how to replace teeth. There's nothing like your own teeth, so it's worth getting really good at this, finding what suits you best and going for it. So I'm just going to concentrate on the techniques. I'm going to use a floss pick initially. The technique, if you just use normal floss, is exactly the same. These do make it just a little bit easier. So I'm going to show you on my model again. I hope you can see. I'll come a little bit closer. So these are nice. These are made by Oral-B. We have them here. It's a bit wider than the normal, some stringy flosses. And if you squeeze them in the middle there, it keeps that floss really tight. So where teeth can be quite close together, it will help you control it and get it in and out of the spaces. So, I'll show you at the front first. Floss the floss down in between the teeth, through the contact point, all the way down as far as it will go. When you've done that, wrap the floss around the tooth you're doing in a C shape, and then floss that tooth. So up and down, good few times, 10 times, get it really nice and clean. And then round the tooth next door, exactly the same thing. Don't be afraid to floss down as far as it will go comfortably. Don't make it sore, but if it slips between the gum and the tooth, 1 millimetre, 2, and it's comfortable, that's fine. You might get a bit of bleeding, that's because you're getting to the plaque that's causing that bleeding. So the more often you do this, ideally every day, you'll find that bleeding comes down, and that will spur you on and motivate you because things will be getting better. So ideally every single gap, once a day. When you come to the back ones, these are really useful because they're straight. They help you get to those back ones, which are quite often the most difficult ones to do. And again, round each tooth in a C shape, like that. Amazon parcel's just arrived. No. Oh, it's alright, excuse me. Love Amazon. Amazon. If you're having trouble getting hold of anything, Amazon. Hope that makes sense. You can give these a rinse, so if they're a bit gunky, give them a really good rinse like you would with the toothbrush, and get the most out of each one. It's fairly strong stuff, this floss, so you should be able to get around the mouth once with one, ideally. If you can get any more out of it, then as long as it's clean, I'm going to say, if it starts to shred or tear, become useless, chuck them out, use a fresh one. Hope that makes sense. Good. The other way of doing it is with the little brushes. So TP brushes, or the Icon ones, which are the ones we have at practice. Lots of different colours. I'll start with the pink one, see if it will go in my model. The idea with these is they go straight through in between the teeth. So at the junction where the gum and the tooth meet, right down low, and then straight through. Will it go through? It's gone through. All the way through. So once you're in, you don't need to bring it up between the contact point because you won't succeed. The teeth meet in the middle and the brush won't come up. Just stay low on the gum, and I want you to brush about 10 times through every space. not just once or twice, but you're brushing, so worth doing well once you've got it in and the angle right. Keep it straight though. If you come in at a funny angle and force it in, sometimes they can bend and then they become weak and then you can't get any use out of them. So in order to get the most out of each one, and you're not getting through thousands of them, just keep them nice and straight. When you come to the back ones, they say not to, but I quite like bending them at an angle, like the TP angle ones. They do make them already angled as well, just to help you get that angle right, because you want to come along again. Oh, it's gone through. And then just straight through. Try not to move the brush that way, because then it will bend. Try to just keep it straight. And again, once you've got it in 10 times, if you see a little bit of bleeding, again, as long as it's comfortable, it means you're getting to where that nasty plaque is, and that will get less the more often you do it. It only takes a few days of it being there before it starts to irritate the gums, which is why we say ideally if you can do this once a day, that is what will give you the best results. Once a day, put a few minutes aside, do it well, and then when I see you, if you're in the rhythm of it, you'll be doing the most important thing really, really well. And it is the most important thing. The most important thing isn't coming in to see me, it's what you're doing at home. That is what really makes the difference. So now's the time to nail that, now that everyone is at home. I know it's boring, it's tedious, they're bleeding, it's not the most fun to do, but if you can come out of this with something positive like that, getting really good at cleaning your teeth, keeping your mouth healthy, then God willing, there'll be no major problems when you come to see us, which hopefully won't be too much longer. We are, like I say, in touch with each other, we're keeping up to date, and as soon as we possibly can, we want to be ready for you, so please trust that we are keeping tabs on that. Again, I hope that's been helpful. The air flosses, etc., they're good as well. I haven't got one here to show you, but they blast air and water in between the teeth, so if you do struggle with something like this, something physically getting between the teeth, then they're the way to go. Lots of people are recommending them for implants, so there's definitely something to them. They're certainly better than nothing, and a lot of people are finding them really useful who struggle with all that stuff. Hope it's been helpful. I might do another one if I can find a different subject, or if you want me to go into more depth, if anyone's any feedback, gratefully received. Take care, and hopefully I'll see you soon. Hopefully we'll all see you soon. Bye.